As we said at the top of the program, whether it's semiconductor chips for medical technology to the much needed medications, modern medicine is reliant on an often complex and global supply chain issues. We certainly learned that during COVID-19, as you heard in our conversation just a moment ago, and during the pandemic. The recent shortage of medication like Adderall have put the supply chain issues consistently in the headlines. And so now we will have a discussion on how to innovate within our medical supply chains in order to reduce the disruptions and the resulting supply shortages. Here to shed some light on all of that are my two panelists. Dr. Pinar Keskinocak is the chair and professor of the Medical of Industrial and Systems Engineering at Georgia Tech, an impressive title. Thank you very much for being with us. She is also the co-founder and director of the Center for Health and Humanitarian Systems, where she advances science and evidence-based approaches to improve healthcare operations, including supply chain management, which will be my first question. And Moh Behnam, who's a partner at McKinsey Company. Moh leads McKinsey's medical products operations working globally. He brings more than a decade and a half of experience with clients in the medical device and life science industries, consulting on issues including supply chain, procurement, and manufacturing. To both of you, thank you very much for being with us. Dr. Keskinocak, I want to begin with you because we've been talking about COVID-19 and really what we've learned about the supply chain and issues involving the medical supply chain as a result of this pandemic over the last 2.5 years.
Yeah, thank you very much for having us here. So medical supply chains, like many others, have a lot of entities ranging all the way from raw material suppliers to manufacturers, distributors, and retailers or clinics and hospitals that basically bring these products and services to us, to people. So they have some unique characteristics. They tend to be more global and complex. In some cases, they have less flexibility than some other suppliers. For example, we might have, in other supply chains, for example, we might have fewer players. So which means that if there is one area of the supply chain that gets disrupted, that might create significant cascading impacts across the entire supply chain. They also tend to be a little bit less flexible in terms of their processes. So they unfortunately embody many of the characteristics that we do not want to have in responsive, flexible supply chains. So that's partly why we have seen a lot of issues, especially during COVID, with medical pharmaceutical supply chains and shortages across many products.
And Moh Behnam, you're really on the front lines of all of this. So I'm curious, what do healthcare companies need to take into account when they are looking at the supply chain? And we talked about Adderall, one of the medicines that has been disrupted because of some of the issues we're talking about today.
Thank you, Steve. First of all, I would like to take this opportunity to extend sincere appreciation and thank you to healthcare professionals and others who were involved in caring and protecting our families during COVID-19. We remember that they put their lives first to protect our society. Now, back to your question. As Pinar mentioned, the medical and medtech and med devices supply chain is a complex ecosystem. And that complex ecosystem gets unstable due to internal and external forces. Now, what companies have done to solve these issues range from short-term tactical initiatives to a longer-term one. In the short term, the biggest improvement that we've seen is establishing end-to-end forward-looking supply chain visibility. And when we say end-to-end, it's from raw material to delivery to the customers. Number two, looking at tactical midterm supply chain planning, which was mostly historically used to use historical demand, and now it's getting more towards real-time monitoring of the need and hence responding properly. And last but not least, establishing and using digital tools such as digital twin to do scenario planning for disruptions. In a midterm, they are looking to broader partnership with players outside their own four walls, i.e. suppliers and distributors, to ensure that they can work with each other to deliver those products to the patients and care for the patients. They are also looking at changes within their own processes to be more agile. An example here is quality management systems, where in medtech, if you want to change supplier to another supplier or a part to another supplier, you need to go through this system to document the changes and show validity of a new product being used or new parts being used. So creating more agile quality management system is another action that they are taking. And obviously in the longer term, looking at optimizing their supply chain and supply chain nodes within the regions to ensure that stability, and looking at the product designs and manufacturing processes are what they are considering.
Dr. Keskinocak, I love the analogy that you had in a recent interview for the Atlanta Journal-Constitution, and you compared the supply chain to race cars, and you basically say, quote, if you turn to the left or the right, they don't turn quickly. My question is why and what needs to be done to improve that?
Yeah, I think they are more like heavy ships, actually. You turn it and then it takes a while for it to shift direction. So I think Mo touched on some of these things. I would say one of the biggest things is visibility. Do we understand the supply chain end to end? Not just thinking about the product and its manufacturer and maybe first-tier suppliers, but going beyond that. Where are the vulnerabilities? Sometimes it's also not sufficient to look at the supply chain from the perspective of one organization, but more from a higher level systems perspective. This is especially true for critical products from our nation's perspective. If there are few suppliers who are producing and supplying those products to us, chances are that there are some overlaps in their supply chains, which they may or may not be aware of. So taking this kind of higher level visibility or perspective and understanding the vulnerable areas in supply chains, I think is really key. So the other thing that's important is putting flexibility into supply chain as much as possible. During what I would call normal times or sunny skies, most supply chains are designed from the perspective of efficiency, which means we want to keep our costs low. And that usually relies on the assumption that we have a well understood stream of demand, well understood stream of supply. So we have kind of this like nice match between supply and demand, right? But when there's a disruption, the supply may just go down, or there might be a big surge in demand at some point. So these two may go out of whack. So if we have flexibility, for example, we are making two products and we could easily switch the volume between the two. If the demand goes up for one, we could adjust our production to meet the demand for that one. That would really help.
Well, thank you for bringing the props. We appreciate that. And let me continue on that front, Moh Behnam, because there has been a consistent supply chain shortage when it comes to semiconductors. We are seeing the growth of semiconductor plants, most notably in Ohio and upstate New York. But how did we get to this point? Why is there a shortage? And how do you fix that part of the problem? Because you can't talk about medical technology without talking about semiconductors.
Sure. Steve, it's important to recognize that when you make a medical device, the lifetime of those medical devices are relatively much younger than the lifetime of a single chip that we have in the market, i.e., I make an MRI that should last for 10 years, but by the time it's getting to the final years, I cannot source the components that are used to make that original device anymore because the technology in semiconductor have moved forward and those chips have not been produced. So that's number one. And number two is the fact that even if you can find a part or similar part, changing from an existing part to another part would require tons of effort. Now, you consider this context behind the industry and the fact that this semiconductor players had challenges in supplies, and also they are the ones who are supplying to other industries, created this shortage situation moving forward. Now, in order to fix this, there are few tactical things being done. As you said, nearshoring is one example where you are closer to your users, i.e. medical device companies, but also you can prioritize how this semiconductor chips gets used based on your nation's need. At the same time, there are some practices that can be done by the OEMs, medical device companies, to ensure the most effective and efficient use of this limited supplies, right? Number one, ensuring that when you are putting a system together, you have a full visibility to ensure all the other components are there, and not end up having, a semi-finished product and then you realize that you already used one chip there versus you could have used it somewhere else. Number two, being effective to source from different suppliers and being able to make that switch easier, and considering this when you are designing your equipment and devices early on. And last but not least, as Pinar just mentioned as well, being able to use the transparency in terms of overall demand in the market to work and get this limited supply and sign them properly.
Dr. Keskinocak, I'm curious because you've been studying this both here in this country and around the world. There is a disparity between what's available in the U.S. and in developed countries versus more developing nations. And I wonder if you can address that disparity in what, with regard to medical technology, quite simply, what you think needs to be done.
I think one of the most important things is to have a portfolio of products to meet similar needs. So just take the example of vaccines. We might have vaccines at different levels of efficacy and different requirements in terms of transportation, storage, distribution. So this is important across multiple aspects. First of all, it's cost. Second, it's the ability of producing at large volumes. And third, the ability to distribute, especially last mile. A product that's a good fit for one environment may or may not be a good fit for another environment, for another subpopulation. So it's very important to have these different portfolios of products with complementary characteristics so that we can actually reach populations or subpopulations within our own country and also around the world. And I just want to highlight one more thing about the last mile real quick. That's where we see a lot of challenges. So we might be able to deliver a particular product, let's say, to a central depot in a state or in a depot in a country, but actually taking the product from there and distributing to the final users is often a big challenge.
But Moh Behnam, I think you would agree that there is a direct connection between the supply chain, some of the breakdown in that supply chain, and the health disparities that we're seeing, even in this country, from more urban areas to rural communities.
I would agree with that, Steve. And as Pinar said, the final delivery and the last mile delivery or last inch delivery matters a lot in this space.
And so let me address this to both of you, and Moh Behnam, I'll begin with you. Are we ready for the next pandemic, the next health emergency, both in this country and globally?
Are we ready? I think we are in a much better place compared to where we were before COVID. That's one answer. But at the same time, we need to acknowledge that supply chain shocks are often impossible to predict, but happen very regularly. Let me share with you some numbers to demonstrate this. We looked at the events that have happened in the last 10 years, and it's important to recognize that the events that would disrupt the supply chain in medtech for 1 or 2 weeks actually happens almost in every 2 years. events that can disrupt the supply chain for 1 to 2 months happens every 3 to 4 years. And in summary, right, every 10 years, medtech companies can use about 38% of 1 year EBITDA. So these things happen often. Now, I hope we won't have any more pandemic coming up anytime in near and longer term future, but we should get prepared by fixing the foundations, which we've done a good work, but still a long way to go. And number two, creating a better partnership to deliver supplies to our patients when and if needed.
And Dr. Keskinocak, the same question to you, the level of preparedness that we have in this country, are we ready?
We made some progress, but I think we still have a long ways to go. We really need to invest more into basic healthcare so that we can actually keep people healthy. Our healthcare system still operates with the mindset of sick care versus healthcare. We talk about patients, even though a person might be perfectly healthy and the goal should be to keep them healthy, but we refer to them as patients. I think there's still a lot of investment that needs to be done into prevention and also sharing credible information with people so that they can take the right actions if and when the next big health emergency might arise.
And Moh Behnam, final question for you. Are there companies, are there industries that you point to that you want to shine a light on that are like, these are the places that will see significant improvement when it comes to the topics that we've been discussing here today?
I think in medtech, there are a few players that they have done a significant improvement in the last 2.5 years. What we see is much better use of digital technology and digital twins to do scenario-based analysis and understand the implications of the decisions in a much more granular way compared to before and use that information to make better decisions. And number two is much better improvement in terms of understanding and getting visibility to end-to-end supply chain. I think the last 2.5 years was a big push to these companies, and we've seen tons of improvement.
And Dr. Keskinocak, a final question for you, because as you well know, there has been a reluctance in this country during this pandemic for many Americans to get the vaccine. And we're seeing that now as we move into the winter months here in the U.S. How do we get beyond that? What is your advice based on your expertise and your research?
Yeah, I think, again, some of the things I mentioned before. Number one, better education and reliable information, so we can actually prepare people ahead of time before an emergency happens. So we don't have to build the plane while flying it. And then number two, really focusing on the information, data collection, and turning it into useful information. For example, if we see low uptake rates regarding vaccination in a particular area, is it because of hesitancy? Is it because we don't have enough supply? Is it because we have the supply but people don't know where to find it? So there could be a variety of reasons as to why we see low vaccination rates in a particular area. But often what we've seen, especially earlier in the pandemic, is that we did not know specifically why. So I think investing into some of those areas, starting with better education of individuals and the public, would help us go a long way.
And Moh Behnam, do you want to pick up on that final point? Agree or disagree?
I definitely agree in terms of the education. I'm not an expert in vaccine and vaccine delivery, so I would reserve any comment on that.
To both of you, thank you. Dr. Keskinocak is the co-founder and the director of the Center for Health and Humanitarian Systems at Georgia Tech. Moh Behnam, he is a partner at McKinsey Company. Appreciate your time today. Thank you very much for joining us.
Thank you for having us.